Welcome to Bullet Point Nursing. My name is Dr. Goldstein. Let's get started. Today we are looking at the administration of blood, and let's begin with what we're talking about. Whole blood is what we receive when patients donate, and this is broken down into its various components. The ones we're going to be talking about are PRBCs, or packed red blood cells, platelets, and plasma. Beginning with packed red blood cells. These contain the oxygen-carrying abilities of the blood. For example, if we have a patient that is hypotensive, which means they have a low blood pressure, and this is related to them losing volume, losing blood, we may use packed red blood cells to correct this. While this is significantly more complex than just administering the patient fluid such as normal saline, this has the benefit that not only will it increase their blood pressure, just like fluid would, it would also increase their oxygen carrying abilities. Indications for packed red blood cells include anemia and blood loss. The level of anemia is often assessed with the patient's hemoglobin and hematocrit, and that is often used as a criteria of when to administer blood products to a patient. Blood is always administered through specialized tubing that's called a Y connector tubing. This contains a special inline filter for the blood to go through prior to entering the patient. It is called a Y tubing because at the top it has two connections. One is for blood and the other is for fluid. That fluid must be regular standard normal saline. It cannot be any other fluid. Blood is stored in the freezer, frozen, and when it is ready to use, it is at refrigerated temperatures. This is obviously significantly colder than our standard internal body temperature. However, in small amounts, this is generally not an issue. If the patient is in shock or is receiving a large amount of blood, the issue of this blood being so cold can become a problem. Therefore, when given to patients that are in shock or when given in large amounts, the blood is often warmed prior to administering it to the patient. Blood must be what is called ABO compatible, and this means that the patient's donor type and the receiving type must match up. Patients may need a calcium infusion if they are receiving a significant amount of blood. The reason for this is because blood is stored in citrate, which binds to the calcium and lowers our calcium level. Packed red blood cells is the most common blood component to cause an acute hemolytic reaction. Symptoms of this include fever, chills, and more. Reactions most commonly begin within the first 15 minutes of an infusion, and a fever is the most common effect that we would see. For this reason, it is standard practice that the nurse must remain with their patient for the first 15 minutes of any blood transfusion. Patient temperature, as well as a full set of vitals, should be checked prior to administering any transfusion, and again at the 15-minute mark. Standard practice is for 2 professionals that are licensed to administer blood, verify any blood unit prior to initiating a transfusion to ensure that the patient is getting the correct unit of blood. If a nurse does identify any possible adverse reaction, the first step is to immediately stop the infusion. And this means if there's any blood in the tubing, do not flush it into the patient. The nurse should reassess their patient beginning with their ABCs. They should disconnect but hold on to the blood and the tubing for follow-up investigation. The nurse should also notify the provider. Next, we're going to look at platelets. Platelets in our body are essential to prevent bleeding. In a patient that is bleeding or that has thrombocytopenia, which is a low platelet count, we may infuse them with platelets. The last portion of the blood that we are going to look at is fresh frozen plasma, or FFP. FFP contains clotting factors. This product must be ABO identical or compatible. This uses a slightly different chart of compatibility versus packed red blood cells. FFPs are indicated for massive transfusions and for clotting factor replacements. Treatment success with FFPs, if we are doing it in regards to coagulation factors, may be monitored through assessing the lab PT or APTT. Finally, any patient who is receiving any blood products, such as all of these mentioned, and albumin, which is also a blood product, or anything that is considered a blood product, must have special consent from the patient due to the fact that many people have objections to receiving this. Thank you for watching. Have a great day.